I know that you've done a lot of work in this area, so I was wondering if you could speak a little bit to the question of what specifically it is within culture of medicine that could possibly allow something like this to happen.
Yeah, I would ask the audience to imagine what's the difference between a literature professor and a doctor in terms of personality and psychology, or a philosopher versus a doctor. So every profession has its own personality profile in some distribution. Obviously everyone's unique. But if you can imagine, in Germany, there are vulnerabilities specific to the profession, and there's vulnerabilities specific to from the historical context, economic context. So in terms of the profession, doctors tend to have a profile of being very conscientious, as do professionals and managers in organizations. So conscientiousness is good, but it also means if there's a protocol, you're going to follow it. Even if you don't really think it's the right thing to do, you might just follow it anyway. So whereas if you're a kind of introverted philosopher, English professor, you might say, conscientiousness, I'm going to do it my own way. I don't like this way anyway. These people are whatever. So, and then agreeableness. So, thinking about personality variables, agreeableness is the variable of, do you have a need to get along with people? Dissenting is kind of tough if you're really agreeable. To be a good doctor, you have to get along with people, teams, dyads, families. So, to the extent that you're a little bit more agreeable than normal, you're also going to be a little more agreeable to not dissenting when you should. Now, think about everyone been to a graduate seminar in the humanities or social science? These people are not agreeable, right? They're going to rip apart everything you say before you finish saying it. So that personality variable is important too to think of. I'd say third, introversion, because to conform, extroverted people tend to conform a little easier than introverted people. And again, doctors are a little more social than probably your average college professor. Openness to experience is a big personality variable that predicts political conservatism versus liberalism. If you're really open to experience, you might just want to try things for their own sake, try new things. Dissenting is new ideas that are dissenting ideas from what you like to do will be really likely to come to your mind. Whereas if you like structure, order, predictability, you're going to be low on openness to experience. So being low on openness to experience predicts a lot of conservatism. So the dissenting ideas, the idea that maybe I shouldn't do this, probably is a little less likely for the physician versus the biologist, the PhD biologist. In the same way, respect for hierarchy, anyone who's worked in a hospital knows, respect for hierarchy. Hierarchy is an important way in which militaries and other hospital-type organizations function, but respect for hierarchy can also be undermining of ethics if the hierarchy sucks. So those are some things I see as personality variables in doctoring.